for the clinic, generally the infants will they going to the washroom and everything. So for the clinic purpose, 1 hour should be eliminated. Remaining 23 hours, this splint should be applied. So this should be applied for 3 weeks. Sorry, 3 months of age. Then after 3 months, this can be this 23 hours can be converted to only night time. Night time this splint will be given, and remaining daytime they will be given CTEV shoes. CTEV shoes. Okay. This CTEV shoes, the peculiarity of this CTEV shoes is this CTEV shoes has generally the foot is it has a more curved medial border. So this CTEV shoe has straight medial border, and it has a deformity. The foot has a deformity like in internal rotation. So it will be having a thick outer sole, thick sole on it, so that it limits the internal rotation, and there will be no heel for the shoe, because already it is in equivalence deformity. If you give a heel, it aggravates the deformity. So after it will be having this flat heel. So these CTEV shoes should be worn for at least another 3 months. So after the the treatment procedure is approximately 1 to 6 months. So after the end of the 6 months, we again check the baby if there is any residual deformity or not. If the correction is maintained, the child should wear the CTEV shoes till the age of 6 years. Till the age of 6 years, and after that serial reassessment is required. If after the completion of the treatment also CTEV doesn't correct, then we have to go for the surgical management. In surgical management, mainly soft tissue procedures and the bony procedures, and finally there will be limb salvage. Means when the baby presents to the clinic at a later stage or the end stage. In the soft tissue procedures, what we will do is, it is entirely a defect of the contractures of the posterior medial soft tissue. So we will start releasing the posterior medial structures such as tendon-achilles, tibialis posterior, flexor tendon, flexor hallucis longus, flexor hallucis digitorum, everything, and plantar fascia, because the sole it is in equivalence deformity, entire plantar fascia will be contracted. The plantar fascia will be released, and capsule, we will address the capsule, because the entire capsule, due to the deformity, the capsule will be contracted stage. So without releasing capsule, if you do any procedure also, again it the deformity reverse. So these all the soft tissue procedures, this comes under the soft tissue. We will release everything. So after the soft tissue release also still the deformity persists, then we go for the bony correction. In the bony correction, what we will do, mainly we have the calcaneum, we have the osteotomy of the calcaneum, means like a wedge osteotomy. If this is the talus, if this is the calcaneum, so a wedge of the bone is removed from the calcaneum. Again this wedge, this bone will be removed, and the remaining calcaneum will be fused with the cavities or pins, everything. So entire then we have the salvage procedures. In spite of doing the soft tissue procedures and the bony procedures, if still the deformity persists, we go for the salvage. Salvage is the last option, and where we will do fusion of the ankle joint. Generally, it's the fusion of 3 joints. It's the subtalar joint in between the tibia and the talus, calcaneocuboid, the fusion between the this is the calcaneum and this is the cuboid. We will fuse this joint, and we will fuse the talocuboid also. These 3 joints will be fused, and instead of 3 joints, the entire ankle joint acts as a single joint. That is, and next option is talectomy. The entire problem lies within the talus. So talectomy will be performed. the age of presentation will also differs the treatment. If the child is presented within 1 year, it is called neglected CTEV. Any neglected CTEV, we have to see whether the foot could be able to come to back is normal or not. If it is able to bring back to the normal, we will do with a series of casts. Then we will go for soft tissue release. If it is soft tissue, sir, we could able to release the soft tissues. If that deformity is reduced, then no need of bone procedures. If the child is presented at the age of 5 years, by the age of 5 years, all the bones will be matured enough and the cartilage will be formed. So the soft tissue procedures may not give him the much favorable prognosis. So along with soft tissue procedures, bony procedures are available. If the child presents more than after 10 years, then directly we may go for the triple arthrodesis or talectomy, depending upon the age. So age of presentation also matters in the treatment of the CTEV child. So and finally, what are the features suggestive of a successful treatment? 1. Cosmetically, no deformity. 2. Stable plantigrade foot, like stable plantigrade foot. 3. Patient could able to squat by himself. Means entire correction of this equinus deformity, squatting. And the last is patient could able to actively dorsiflex and plantar flex the ankle. Dorsiflexion and plantar flexion at ankle. If these are achieved in our treatment, then we can say the child is got treated successfully, and we will ask the child to review us at a periodical based on the deformity and what is the deformities left.